In this scenario, a Spanish architect, abroad on a business trip, suddenly feels an acute pain in the left side of his chest. He uses his mobile phone to call for assistance and transmits his cardiological data with the help of ECG equipment integrated into his phone. In the Emergency Control Center, a virtual environment is immediately constructed in which all information needed for the optimum care of the patient is processed and made available to all those involved. The patient's location is automatically identified. Based on this, a navigation system determines which ambulance service can reach the patient the fastest. Simultaneously, an emergency patient record is created, where all the emergency relevant information of the patient's medical history are combined and translated as necessary. Based on the historical data and the current vital data, an initial diagnostic report is compiled by a grid service. These findings are made available to paramedics on their way to the patient.
Nee, leider nicht.
Hallo, hier Dr. aus der Uniklinik Tübingen.
Ich bin die begleitende Notärztin, ich fahre gerade zu dem Patienten Ernesto Sanchez.
Taking into account the immediate diagnosis, the distance to travel and available bed space, an appropriate hospital is chosen. Medical equipment for patient monitoring is harnessed and language is processed automatically. Consequently, any symptoms and findings captured during the examination and treatment are stored in the emergency record, thus facilitating an improvement in diagnosis and documentation.
Nein, nicht nötig. Wir haben alle
The hospital's casualty unit is prepared through the incoming patient's medical records. As demonstrated, mobile grid technologies offer the possibility of bringing together and employing the necessary information, resources, participants, as well as the required knowledge directly at the scene of an emergency.